Namaste friends. Today I am going to discuss about a kidney disease called IgA nephropathy. So it is an autoimmune related kidney disease. So it's a big video which I am going to describe about causes, reasons, solutions. So everything I am going to discuss. So please watch till the end so that you can get a good knowledge regarding the particular disease which most of the people don't know even they are suffering with the same disease. So that my intention is to take knowledge into the people who are not even educated. Okay, just please subscribe this video, our channel, and please share this video to your friends and family members so that it may help to them. So today I am going to explain about IgA nephropathy. So for that I have successfully completed a course from a international organization, National Kidney Foundation, which consumed lot of time and effort. So that course name is the IgN Treatment Pipeline Complementary Pathway. So I have successfully completed the course. This course has been supported and funded by our well-wisher Kamalakar sir. So see, to get the knowledge, whatever I am saying to you, I should give a scientific and valid information so that it will be helpful for the people. So I have been working with the kidney patients from 15 years. Along with that, I have been working with different kind of lifestyle diseases like diabetes, blood pressure, hormonal imbalances, skin problems, bone and muscle related problems. So for doing my research work, there are a lot of people who are supporting Gomata Arogya Ashram. With their help, I am doing courses. See, if you see this course, this type of courses, we have to pay fees in euros and dollars, which cost too much. So thanks for Kamalakar Garu, who has been helping our Gomata Arogya Ashram activities. Okay, let us jump into the subject. What is IgA nephropathy? It is an autoimmune condition where your own body immune cells attacking your own kidney. So there is no culprit outside of your body. The culprit is within you. So you have to fight with you. You are the enemy. So this is called autoimmune disorder. So most of the times nephrologists or doctors not even inform patients about the seriousness of the problem to the patient. Maybe because patients may not understand, maybe doctors doesn't have time. Okay, so to learning the basic principles, reasons, causes of the disease will help us to get out of the disease. So unless you are completely educated about the disease, unless you are completely educated about the problem, you cannot get the solutions. So that is why I'm making this full length video so that you get valid information regarding the problem. So usually kidney damages happens. First reason is diabetes, that is diabetic nephropathy. Second reason is hypertension. So other than that, this kind of disorders where it starts in the digestive systems. When we eat junk food, processed food, refined food, so artificial ingredients, it will damage our gut lining, intestinal barriers. So in a way, it will create a path for the pathogens and undigested particles enter into the bloodstream, where that create an unwanted immune response. That immune response will create some kind of immunoglobulins, some kind of proteins, where they travel through the blood and deposited in the kidney. They will ultimately damage the kidney micro functional and structural units called nephrons. That way, they make the kidneys rigid, lifeless, and they lose their genetic capacity of healing, and they lose their mitochondrial function. So they become fibrous. So that is called fibrosis, like liver fibrosis. You may have heard about that. So the same way kidneys will damage. So, then they will slowly leak protein in the urine, and they will accumulate unwanted nitrogen substances like uric acid, urea, and blood urea nitrogen in the bloodstream. It will cause damage to total body, and at the end of the day, patient will die with the heart disease. So this is the IgA nephropathy. It is not which come from any other disease. It is which originated in our stomach. So most of the times we take very easy about eating. We feel it is for enjoyment. It is for luxury. It is eating is an emotion for us. But see, this may complicate lot of health issues. Sometimes, in a minute manner, this IgG or IgA nephropathy can travel to the next generations through genes. There is a chance. See, what you are eating today not only suffering you but your next generation. So please be aware of this and please concentrate on what you are eating. So let us see the research findings. On the screen, you can see biopsy report of different people from a research paper. There you can see IgA, IgG, IgM, C3, C1q. They are the antibodies which we found, which we can found in biopsy. So to identify IgG or IgA nephropathy, the only way is biopsy. Biopsy means nephrologist or your physician will take a minute piece from the kidney and they send it to the lab. There they will find these particles. So like for cancer also same kind of diagnostic procedure is there. This way we can identify whether we have IgA or IgG nephropathy. Usually this disease comes at the age of 30 to 40 years. So most of the times there are no symptoms. So people think easy, take it easy, and by accidentally any injuries or any fever or infections, by accidentally we do some diagnostic tests. There we find out increased creatinine, leaking protein in the urine. So they refer to the nephrologist. Then they will give some basic treatment. Later on they go for the biopsy. They will come to know you are suffering with IgG, IgA nephropathy. It is an autoimmune disorder. So your immunity itself attacks your kidneys. So this is the research paper regarding biopsy. And in this research paper, you can see there the chains of proteins which are flowing in the bloodstream are attacking the functional and structural units of the kidney called nephrons. You can see that clearly. So they gradually diffuse the function of the nephrons and they will damage the glomerulus. So they will cause tubular nephropathy or membranous nephropathy. That is called IgA nephropathy or IgA nephropathy. So these antibodies will kill our kidney cells. Again, so this is a typical situation. So because the reason is inside. So what to do? What are the treatment parameters at present? Especially for kidneys from 1985 onwards, there are no new medications found. So usually they give blood pressure control medicine and metabolic acidosis control medicine like sodosis, nodosis, sodium bicarbonate. So these are the only medical practices which we have been practicing. But this kind of diseases, they give steroids, immunomodulators in order to suppress our own immune system, which will obviously cause fungal, bacterial attack, and suppressed immunity is viable for the infections in a patient. So it is a complicated situation. Other than that, these steroids which you use to suppress your immunity may cause steroid-induced diabetes or steroid-induced kidney damage in turn. So this is the problem. So there are different kind of medicines like immunomodulators, steroids, complement chain inhibitors. These are the medicines they use, but they are not effective till today. Still research is going on. So mitigating the consequences of ongoing nephron loss is a very important thing, and halting the glomerular inflammation is another important thing. Reducing the production of immunoglobulins, that is another important thing, and stopping profibrotic signals in the kidney. So these are all things we have to maintain. So what are the natural alternatives? Especially in India, we have excellent herbs which have both immunomodulators and anti-inflammatory factors. So herbs means a plant-based medicine where they are utilized by Siddha, Unani, Homeopathy, Ayurveda. Everywhere you can find herbs, even in traditional Chinese medicine, Tibetan medicine. So herbs are abundant of antioxidants and anti-inflammatory compounds. So we can utilize some kind of herbs to mitigate our immunity, to mitigate our cell death, to mitigate mitochondrial function, like methylene blue, which will rejuvenate genes and mitochondrial function, cellular metabolism. So we can use them. So one side we can use the herbs, and the side we can use nutrition supplements. By changing constructive lifestyle modifications will hinder the growth of these autoimmune disorders, so that a person can live his full life happily and he can enjoy his quality of life. So what to do? You have said different kind of herbs. What are they? So already video is very long. So for that, what I did, I prepared a book called Forest Herbs Kidney Tea. Please go to the Telegram app. In the Telegram app, you search Gomata Nutrition and Health Education Telegram channel. In the channel, you just type Forest Herbs Kidney Tea. So you can get the food PDF book. In that book, I have given complete herbs which are very helpful for the kidney patients, where you can prepare yourself in your home, in your surrounded area, you can get those herbs. So that guidance will be very helpful to you. And one more book I have released. This is also helpful for most of the patients, because in that book I have given pictures of the food items and level of the sodium, potassium and phosphorus. To maintaining the proper level of sodium, potassium and phosphorus is very essential for the kidney patients. So that book name is Kidney Food List. Kidney Food List, Sodium, Potassium, Phosphorus. You just type that name in the Telegram channel, Gomata Nutrition and Health Education. You will get that PDF copy. In that book, it is around 250 pages. Every food item is there, and below that picture, what is the level of sodium, what is the level of potassium, what is the level of phosphorus. According to guidelines, 200 milligrams per day sodium, 2000 milligrams per day sodium, 2300 milligrams potassium per day, 800 to 1000 milligrams phosphorus per day intake is suggested. It differs person to person based on his diagnostic reports. So please check your diagnostic reports and use this book, so that you can mitigate your diet in order to maintain your biochemical factors. And one more book is there, that is called Kidney Doc English and Telugu. So all these books are in bilingual, Telugu and English, so no need to worry. So Kidney Doc English Telugu book, you also download this in the Telegram channel. In the Kidney Doc book, I have given sample meal plan, dietary protocol, and all those books I have given information regarding the patients who have been successfully completely get out of their kidney problems, and those who successfully get out of the dialysis and living happily. So there are the patients who comparatively less dependent on medicines, pharmacological interventions. So these are all the success stories I have given, diagnostic reports with proofs and test reports along with live videos. So please go through those books. You can find and educate yourself, so that you can mitigate your health issues. Whatever information you are expecting from me, please feel free to comment in the comment box, so that I can reflect on your comment in future videos. Thank you.